made such a hard time for that student.
I can't wait to take on 60.
Page 919, hydroxycobalamin, also known as cyanokit. Right? Nobody calls it hydroxycobalamin. It's easier to say cyanokit. It's an antidote for cyanokit? Cyanide, right? It's the go-to for cyanide poisoning. It is a synthetic injectable form of vitamin B12. Vitamin B12 is cobalamin, hydroxycobalamin. It's got water added to it. Binds with cyanide to form a non-toxic cyanocobalamin, preventing the toxic effects. It just binds to cyanide, so cyanide won't work. Super, super safe. We give it for cyanide poisoning. Contraindications.
Not poisoned by cyanide.
None?
Allergic to it.
Hypersensitivity.
Hypersensitive. That's it.
It's a vitamin.
It's a vitamin. It's vitamin B12. So they may be allergic to like a preservative. So if somebody already had it once, they had a reaction to it, okay, odds are they're only going to get it one time in their life, if they get it at all. There are too many cyanide overdoses out there, especially repeat ones. Side effects: hypertension. It does push your blood pressure up a little bit. Could have an allergic reaction, could have GI bleeding, and of course, nausea, vomiting, right? Dizziness, headache, as it's from hypertension. And then injection site reactions, like it's irritating to the skin or to the veins. Do not use Valium, dobutamine, dopamine, fentanyl, nitro, propofol, sodium nitrate, or sodium thiosulfate in the same IV. Basically, it needs its own IV site. So if you had other drugs to give, just start another IV. Just hydroxycobalamin cyanokit gets its own IV. It comes in a red, like magenta red powder, and it's in a large glass vial. And when I say large, like half the size of this cup, large glass vial. It's pull up an image of it right here. Large glass vial of red powder. It's really simple. I was going to say you mix 200 cc's of fluid, usually Ringer, saline, or D25 or D5, excuse me, into it. Doesn't matter which of them. You just it says put 200 cc's or 150 cc's of fluid in here. It's kind of like Sumimedrol, just so the powder dissolves, and then you run it in. It's an IV infusion. So when you put it in there, just kind of like roll it so the powder dissolves. Takes about a minute, if that. Okay. Initial dose, 5 grams over 15 minutes. So there's only 5 grams in here. I need this whole thing to go in over 15 minutes. So if it was over 10 minutes, right, what size or what type drip set would I use?
10 drop.
10 drop. And then I would use the volume of this. So if this was 200 mLs, you would do
200 drops a minute.
200 drops a minute. That's 10 minutes. If I wanted it to last twice as long,
You'd cut it in half.
so that would be
100 drops
a minute, right? So you can kind of wing it. You can kind of guess it. You just,
So it'd be about 150 drops a minute.
yeah. You really can't give it too fast. So just give it over 10 to 15 minutes, preferably over 15 minutes. It says at a rate of 10 to 15 mLs a minute, just over 15 minutes. Maximum dose, 5 grams. The dose is 5 grams, we give it 1 time, okay? You can call medical control about a second or a repeat dose, which is also 5 grams. Okay. Pediatric, 70 milligrams per kilogram. 70 mLs per kilo. So can you do that math in your head?
Mm-hmm.
Times 7? Yeah, all right, 5-year-old. 1, 3, 5, 10, 15, 20 kilos, 20 times 7.
140?
140. Add a 0, because it's 20 times 7.
So
1,400. 1,400 milligrams would be 1.4 grams. You can make an educated guess. Maximum single dose for peds, 5 grams. Okay. Onset, rapid, not quite as fast as the adenosine, but pretty damn fast. Because cyanide works quick, this reverses it real quick. Okay. Peak effects within 8 to 10 minutes. It's doing its maximum work. Duration varies, depends on how much cyanide they have in their system. Pregnancy category C, okay, may cause harm, but the harm is not as bad as the cyanide poisoning would be. So, breastfeeding should stop, right? It is the preferred drug in known or suspected cyanide poisoning, or a high index suspicion of cyanide poisoning with patient with a depressed Glasgow coma score, respiratory difficulty, and cardiovascular collapse in the setting of an enclosed space fire. So the fire victims were pulling out cyanide as a major component in smoke. The smoke inhalation patients, give them some cyanokit. Why do we not carry it? It is super expensive. Right, places had it on grants, and it works amazingly. I've given it, but the grants run out, and the stuff expires, and it doesn't get replaced. I know Orlando went to replace ours because it was all expiring, and they went, we're not going to carry it anymore because it was going to be like $164,000 to replace what we had for 1 year. Like, no, not happening. Although some places will do things like we will put it on our transport units. Because if it's a smoke inhalation, are they going to get transported? Yeah, like that's probably who's going to have to manage it anyway. But very, very simple. Just remember, pulse oximetry will be inaccurate because cyanide is just like carbon monoxide. It's going to screw up your pulse ox readings. And then another kind of weird side effect is it makes their pee and their skin look almost magenta red in color. So you're going to get very flushed. It's just because of the vitamin B12. That's cyanokit, right, or hydroxycobalamin. Your other drug is 2-PAM, correct?
138 or 938.
938, thank you. Proloxamine, right, also known as 2-PAM or protopam. Everybody calls it 2-PAM. Why?
Easy.
It's the easiest. A colon esterase reactivator or antidote drug. Colon esterase. So if you remember in your parasympathetic nervous system, acetylcholine, the cholinergic side, right? Not the sympathetic side, the parasympathetic side. Acetylcholine is the neurotransmitter that moves across the synapse. And cholinesterase takes it off the nerve, right? So it can be stimulated again. Right? Organophosphate poisoning is what happens. It doesn't take it off. It turns the cholinesterase off. So the nerves are constantly being stimulated, the overflow parasympathetic response so you get your sludge signs and symptoms. So we give 2-PAM and atropine, and it reactivates the cholinesterase so it starts removing it, decreasing signs and symptoms. Very safe drug. So it binds to organophosphate and breaks down the alkaline cholinesterase bond to restore the activity of acetylcholinesterase. Basically, it turns it back on so your body can correct it. It's the antidote for organophosphate poisonings and nerve agents, which they're lumped in the same type of poisoning. Contraindications. They're allergic to it. Reduce the dose in patients with renal function disorder or hypertension or patients with myasthenia gravis. Right? If they're on dialysis, if it says renal function disorder, if they are on dialysis, they have dialysis shunts, then think about lowering the dose. Right? What's the other option? They die. Okay. Side effects: dizzy, drowsy, headache, neuromuscular blockade, seizures, laryngospasm, hyperventilation, apnea, tachycardia, cardiac arrest, nausea, muscle rigidity, muscle weakness, rash, pain, injection site, especially in geriatrics. Can cause severe hypertension, muscular weakness, headache, tachycardia, visual impairment. An overdose can cause profound neuromuscular weakness and subsequent respiratory depression, especially in kids. Lots and lots and lots of side effects. Right? Most of these side effects are the opposite of the sludge signs and symptoms. So like your body's doing all the sludge stuff over here, and you give this and kind of whoop, quickly switches, and it's such a fast change, people's these side effects. Cardiac arrest, even though it's listed, is extremely rare. Avoid using it with sucks, morphine, aminophylline, theophylline, or other respiratory depressants, including barbiturates, opioid analgesics, and sedative hypnotics. It will chemically react. So think of no morphine, no narcotic pain meds, no sucks for innovation, and no etomidate. So if they have a seizure, can I still treat the seizure? Yes. That's a barbiturate, that's okay. But basically, no sucks, no etomidate, no pain meds. Consult with medical control for the dose. It comes basically in an auto injector. It is part of what is known as the military nerve agent antidote kit, NAAK, nerve agent antidote kit, formerly known as the Mark I kit, where it has the two auto injectors. One is atropine, one is 2-pan. Okay, they've now combined the two of them into the same auto injector, and they call it duodope. They're both at the same time. So there is no like drawn up magical dose or anything like that. Onset in minutes, peak effects in 20 minutes IM, 15 IV. Pregnancy category C, they may get a little bit of muscle rigidity at first, but pretty safe drug to use. I've only given it twice, and it works pretty well with atropine. The newer military kits, because with nerve agents, seizures are common, they actually have Valium in the mix. So, boom, it's giving them a little bit of Valium with the nerve agent in there. Here's the reality with the nerve agent kit. Okay? You need to have it right then and there. Otherwise, you're going to die if you're exposed to nerve agents. So, if you ever saw the movie The Rock with Nicolas Cage and Sean Connery, right? They break into Alcatraz because some guy is trying to launch, nerve agents into the city and whatever, and he gets exposed. So he pulls out the antidote kit, boom, saves his life. It's dramatized a little bit for Hollywood and everything, but that's the procedure. He actually does it intracardiac. We don't do that. The reality, nerve agent kit. You have a mild exposure, they say use 1 kit, a moderate exposure, use 2, a severe exposure, use 3. Okay. You have a mild exposure, you use 1, you bought yourself about 2 more minutes of life. Moderate, you use 2, you bought yourself about 2 more minutes of life. Severe, you use 3, you bought yourself about 2 more minutes of life. Right? Why? Because the military's version was, oh shit, we've been exposed to nerve agents, so nobody else comes down here. You still gonna die. There are people who have been exposed to nerve agents that have received 20, 30,000 grams of atropine and similar doses of 2-pan. Yeah, what's our dose of atropine? 1
Milligram.
milligram. So 1,000 milligrams would be a
1,000.
gram, and there are 27,000 grams, so like 27 million doses of atropine. Do we have 27 million doses of atropine in all the agencies and hospitals in Volusia County? You get a nerve agent exposure, what's going to happen?
You did.
You're going to die. Safe drug, simple drug. Don't overthink the drug. You good?